The effects of speech rate on speech perception for healthcare workers. Healthcare workers are constantly communicating important technical information to all sorts of patients, and for that reason, it is so important to know the most effective way of speaking with patients. When one has trouble perceiving speech and cannot change the noisy background, one coping strategy may be to adjust the talker's speech rate rather than simply adding intensity. Slowed speech may reduce the need to ask for repetition or clarification. People tend to speak very quickly, so the request of slower speech from a patient is valid and must always be noted. The basis of comprehending speech includes one's age, cognitive level, hearing ability, familiarity with the topic, and the proficiency in the language. There is no single speaking rate that is most appropriate for everyone. Older adults with normal hearing have more difficulty than younger adults while processing fast speech. This is especially true as background noise increases. In fact, older adults benefit more from slower speech rates versus average speech rates. This is because they cannot deal with the increased cognitive demands of both fast speech and background noise. Older adults, about 75 years and older, do not benefit from extremely slowed speech, but rather slightly slowed speech. Their auditory systems are not able to tolerate extremely slowed speech. Faster rates, though, also result in poorer speech perception. Therefore, when speech is presented too rapidly, the input cannot be processed efficiently. Speech should be presented in a clear, consistent manner with little to no background noise. It is accurate to say that a slower speech rate facilitates non-native speaker listening comprehension. Most non-native speakers struggle more as rates increase. It is very important to take this into consideration while interacting with patients who are not native to the English language, no matter their proficiency level. In addition to using a slower speaking rate, ensure there's little to no background noise and always ensure that the patient understands through nods or gestures. Children with speech and language impairments perceive fast speech more poorly than normal developing children. Increased rates influence their comprehension and recall. Therefore, consider how instructions and explanations are presented to these types of patients and avoid fast rates in instructional situations. Always be conscious of which speech rate is best for your patient and remember that slower processing capabilities affect speech perception. Across the board, listeners experience difficulty with increased speech rates, so it never hurts to make a conscious effort to slow your speaking rate down while interacting with and instructing patients.